Are deadlifts dangerous to your back? In this video, we will look at the spinal biomechanics, the theory of how you might injure your spine and your discs, what does or does not happen, and what are the risks and possible rewards of including deadlifting in your exercise program. I'm Dr. Anthony Davis. Let's look at the research. The main theory on how you might injure your spine during deadlifting is that we will introduce what is called a shear force in the spine, and that will essentially, as you can see here, I've made this illustration showing that the spine, that one vertebra might slide forward on top of the vertebra below it, and that might cause an injury to the disc in between those segments, most notably in the lower spine. So it is theorized that bending over and lifting with your back, so to speak, is going to create these shear forces and injure your spine. Well, let's see if that's the case. What kind of forces are actually present in the spine during what we would call stoop lifting versus squat lifting? Let's check it out. So let's go ahead and dive into the research. Okay, so does deadlifting seem to change the hydration of the actual spinal discs? So that would be a dehydrating effect. So this study was looking at exactly what I'm saying here, and their conclusions were that the movement of water molecules within the lumbar intervertebral discs is suppressed by high load deadlift exercise. So essentially, this is going to be due to mechanical stress on the discs during the deadlift exercise. So it is possible, so this study, if you only looked at this study and you did not look at the full picture of the research on deadlifting, you might be able to cherry pick this research right here and say, well, see, it does negatively affect the discs. Well, let's look at a little bit more research and see, and take this into context. So we do have another study that I found. Now this is a little bit older, but they also found kind of a similar finding. Now, interestingly, they did not see increased disc degeneration when they were doing MRIs of people who did do heavy lifting versus people who did not do heavy lifting. But there was a little bit of some essentially risk factors, some dehydration in the spinal discs that could potentially lead to degeneration down the road in people who were weightlifters. Now, I want to make a comment really quick before we dive into more literature here. There is not a lot of good literature. This is a problem with the research right now, is that we do not have a lot of good literature that specifically compares deadlifting with heavy weight compared to other heavy weighted exercises. So it's really hard to make a fair judgment of if the specific exercise of deadlifting is specifically dangerous. So some of this research is looking at heavy weightlifting in general, and we're going to make some assertions based on that, which may or may not pan out to be true if we do get better research down the road. And now we have another study. This was looking at the risk of having an injury to the spine and spinal degeneration associated with doing a job, having an occupation that requires you to do a lot of heavy lifting. So that could be some type of manual labor, but it could easily just as well be working in a hospital, but having to move around a lot of boxes or people or anything like that. So if your job demands that you do a lot of lifting, do those people have more disc degeneration? And they found that yes, there is a modest association between having an occupation that requires you to do a lot of loading and lifting and having a slightly degenerated spine. However, I want to point out, and we'll talk about this a little bit later in this video, but this would constitute a high volume and high frequency exercise without sufficient rest in between, because you're doing this 5 days a week, potentially for 8 hours per day, which is a lot with not a lot of rest. So I'm showing you this study to show you that, I mean, when you're lifting things at work, sometimes you're going to be doing a deadlift, right? You're basically doing a deadlift. So does doing that hurt your spine? Well, maybe, but these people are doing it all day, every day, so maybe that's too much. That does not necessarily mean that deadlifting in a controlled fashion occasionally it has the same results, right? So again, this is another way where you could cherry pick this study and say, see, lifting is bad for your spine, but I don't think that's a fair comparison. By the way, if you want a copy of these notes, you can download them if you are a member on my website. You can be a member for as little as $5 a month at this time, and you get access to all of my PDF notes and more. Okay, now let's look at two different ways of lifting. So we could lift in a stoop lifting, which this is basically a deadlift, right? Or we could try to do a squat. Now, the conventional wisdom is that you should try to squat down as low as you can if you have to lift a heavy box off of the floor, and use your legs to lift. And that if you do this opposite, this stoop lifting, as we call it, like this piece of research here looked at, that this is going to place unwanted stress on the back, so that you'll be lifting with your back instead of your legs. But when they actually measured the stressors on the spinal discs in this study, they found that there really was not any significant difference in the stress on the spine in either of these two positions. So really, if you have to lift a heavy box, which is a deadlift, you could choose to squat it, or you could choose to hinge forward and stoop lift it, which is a deadlift. And either way, it does not necessarily increase the stress on the actual spinal discs. So both of these, according to this study, appear to be equivalent options. So not only that, but if we actually start to look at research on people with low back pain, and we say, well, what if we not only include deadlifting as part of a fitness program for people who don't have pain, but what if we actually have people in pain do deadlifting? And we find that if we include deadlift in low back pain rehab, that, well, exercise programs that included deadlifts can improve pain and function in people who have low back pain. So actually it can help people get out of low back pain to do deadlifting. So here's an interesting study, and this one looked at the way that we deadlift. And I don't mean technique, what I mean is how often, how heavy, and how frequently do we do it. So it may be that it's not about the deadlift itself. Deadlifting is fine if you do it with an appropriate amount of weight, an appropriate frequency, and you do an appropriate amount of reps, and you give yourself plenty of rest in between. So what this study was suggesting was that if you did a high load, so pick up heavy things, and you don't pick it up a lot. So pick up heavy things, so maybe 5 times, and you do a low frequency, so maybe 1 or 2 days a week at most, then we might actually have a regenerative effect on the spine. So it might, not only does it not hurt your spine, it might actually help to heal your spine. But if you do the same exercise with a high load, so heavy stuff, high volume, meaning lots and lots of repetitions, and high frequency, meaning many, many days per week, well, then we have a degenerative, it's gonna hurt your spine to do it. So basically, it might not be about the exercise specifically, but about how you program it into your workout program. Basically, give yourself plenty of rest, don't do it too often, and you might be just fine. But now let's look at the overall injury rates. So let's really zoom out and get the big picture here. So this study was looking at the injury risk for weightlifting, and we did find that, types of exercise like bodybuilding, where they're very isolated, they're very controlled, they're trying to intentionally put the stress into the muscles, so to speak, and less stress on the overall body. So they're not doing really big compound lifts like deadlifting and heavy squats and that kind of stuff, that they had pretty low injury rates. They had, between 0.24 and maybe 1 injury per 1,000 hours of training. So that's pretty low. But then you did see a significant spike in injury risk for strongman competitions and Highland games. So people who are really picking up seriously heavy stuff and doing it in a sport. So for that type of competition, we saw a lot more injuries, right? However, if we really zoom out and we say, well, okay, but what's the injury rate compared to doing sports like soccer, rugby, cricket, etc.? And we see, well, sports, it's more like 15 to 81 injuries per 1,000 hours of training. So nearly 80 times, up to 80 times more likely to get an injury from sports than you are from bodybuilding. And a little less than what, basically 10 times more likely to get an injury from sports than from a strongman competition. So definitely less risky than sports, but this is still interesting to me because I'm saying, okay, I'm seeing this and saying, okay, the bodybuilding had a really low risk, but these strongman competitions were way more risky. Well, maybe that is the more that your weightlifting becomes a sport and that you're picking up insanely heavy things and you're trying to break records and beat another person and outlift them, you're more likely to lift irresponsibly and pick up more weight than you can really handle because you're trying to push it to the max. Well, of course, then you're more likely to get injured. But if you take an approach of being really diligent about your training, being really intentional, not forcing it too much, and by the way, bodybuilders tend to not pick up insanely heavy weight anyway, because you can get more muscle definition. You don't need to pick up insanely heavy weight in order to get really good muscle definition anyway. So maybe that style of training. So if we were looking at deadlifting, we might say, well, if you're deadlifting at a CrossFit competition where you're pushing it and trying to get a personal record, well, yeah, you might get injured. But if you're deadlifting in a responsible way and you're not forcing it and you're not trying to compete with anybody, maybe you're way less likely to get injured. And that the injury rate in general is less than sports anyway, pretty low. So probably not a huge risk, period. Again, this is looking at overall weight training that includes deadlift, but this was not specific to deadlifting only and did not compare deadlifting to, for example, squatting. But now let's really look at the big picture, which is, okay, there may be some mild risk associated with deadlifting and heavy weightlifting in general, but what are the benefits of heavy weightlifting? And this study looked at the fatty infiltration in the paraspinal muscles in the lower back, and that has been directly linked to low back pain. So if we have a lot of fatty infiltration in those muscles, then people tend to have more back pain. So in other words, we want to be strong in the muscles of the spine. And this clearly showed that weightlifting will reduce that fatty infiltration and give you stronger, tougher muscles, which we know is related to better health and lower pain levels. But really, if we look at weightlifting in general, and I realize that this doesn't specifically look at deadlifting, I wish we had better research on this, but we just don't. But weightlifting in general, even though weightlifting has some risk associated with it, all the benefits of weightlifting might be so much that it outweighs the risks, because the benefits of weightlifting include, yeah, weight loss, but more importantly, reduced visceral fat. So you do not want fat in your organs. That's visceral, if you don't know the meaning of that word. So you do not want fatty infiltration of the liver, for example. You don't want fat in or on or around your organs. That is not good. That is linked to really, really bad health outcomes. So weightlifting reduces that. Weightlifting also reduces disability. It reduces blood pressure. It improves your insulin sensitivity and helps people with diabetes. It improves your blood lipids like cholesterol and your triglycerides. It improves your bone density and reduces the risk of fractures as you get older. And it reduces pain. So the benefits of resistance training in general are huge. So we are lacking really good comparison studies on deadlifting compared to other specific exercises. I wish we had more robust literature on that, but the studies that do exist really show very, very mild increased risk, if anything. And when you look at the comparison of that and the overall injury rates, which are generally mild compared to other types of activity, and then we compare that to the general health benefits of weightlifting, in my opinion, I think that the benefits really, really strongly outweigh the mild risks associated. So if you're going to deadlift, I think it's perfectly safe. I just think that it's important maybe not to compete. That's just my opinion. I know there's people that are going to really strongly disagree with me on that. But I think that if you start pushing it and treating it like a sport, you're just more likely to get injured. But If you're just lifting moderate amounts of weight and you're doing it diligently and you give yourself plenty of rest in between workouts, you're not deadlifting every time you go to the gym, for example, that would be very silly of you to do, then you're much, much less likely to see any type of injury. And you'll be able to bounce back fast and feel great doing it. If you have questions, leave them in the comments. I'm Dr. Davis, and I'll see you in another episode.